Hello everyone, I'm Dr. Yatri Thacker. I am really feeling grateful for being invited by Bioderma as they have asked me to talk about skin care and baby care. So here I am to give my expert opinion. So you can ask me any questions regarding bathing, baby care and skin care of the baby. Let me just start by giving a brief introduction about myself. So I am a homeopathic doctor, a mental health expert, and the founder director of Baby and Me programs. Baby and Me programs are specially curated by me, where we take care of your parenting journey, right from prenatal, infertility, we have pregnancy programs, post-delivery care, baby care, and then parenting from toddlers to teens. We bring it all together through a holistic approach where we understand the deeper issues of the child and accordingly guide them, treat them, and help them further. But today I've come here for a different reason, and I thought today let's talk about the skin care because it's the most common question that parents want to know and want to take care of the child. You know, a baby is in a mother's womb for 9 months. The mother carries the baby for 3 years in her arms, and she carries the baby in her heart till the day she dies. So therefore, let's make the most of it while you are taking care of your child. And skin is one of the most delicate part of your body, and it's the best accessory that you can carry. So why not talk about skin today? There is a difference between adult skin and the child baby skin. And what is this difference? So baby's skin is very fragile, it's sensitive, and it's actually the epidermis, or the outer layer of the skin, is just 1/3 of that from that of the adult. We adults have a skin which is much more thicker, and with the climatic changes, environmental changes, the dust that we are exposed to, the chemicals that we are exposed to, our skin slowly develops to take care of these exterior hazards. But baby skin is not so. It is developing over the time. And since it is so fragile and soft, there is something called a skin barrier, which is produced by the skin. And what does the skin barrier do? So the skin barrier technology is basically when the outer skin is trying to protect from any kind of infection, bacterial infection, fungal infection. At the same time, internally, it is also repairing. So there is this skin barrier technology which skin automatically produces in the baby, and it takes some time for it to develop. Therefore, if you see, the skin of the baby is paper thin. It's literally so delicate and so soft. Also, the pores are not well developed. So what we as adults get goosebumps, but children do not. And why is it so? Because the skin is still developing. So the children feel cold very easily. They do feel hot. They perspire much more because the pores are open, and therefore leaves dry skin. So child's skin has to be pampered in such a way that all the moisture that the baby is losing, we need to protect it from the moisture removal from the body, and therefore prevent it from drier skin. So once we understand the difference between the baby skin and the adult skin, let's understand what do we do about it. So how do we nourish baby's skin? One, let's talk first and the foremost about bathing. Now, till the umbilical cord of the baby doesn't fall, we cannot give like a proper tub bath to a baby. So just give a sponge bath. And after the umbilical cord falls, which is usually by about 10-11 days, then you can give a proper tub bath to the baby. But remember, till the baby is about 3 months old, the head or the neck is the most sensitive part. So we need to hold the baby's head and give a proper support while bathing. So what I usually recommend parents is you should give bath to the baby about 3 times in a week, and other times give them a sponge bath. And while giving sponge bath, it is quite essential to take care of the folds, especially in between the fingers. Then the babies have they look so cute because they have so many folds, or the fat. So just separate the folds or the fat and then clean it there, especially the genital area. For the baby who are boys, see to it that under the scrotum as well, you clean the baby. For the girls, see to it that the vaginal area, which is so sensitive, one needs to be quite careful about it, and therefore see to it that you wipe the private area from upside down, not from down to up, because there could be chances that if the child has done potty, has not been clean, you can spread the infection from the anus to the vaginal area, especially for the girls. So these are the few things you need to be careful while cleaning the baby or giving them sponge bath. But when you give the bath to a baby, like a proper tub bath, there are few parameters that you need to be careful, especially till they are being able to sit. That is about 5-6 months of age, when the child is developed in that way and they can sit. So what is it that you need to be careful in your bathing station? So see to it that there is a tub, you have lukewarm water. Now that's very important. If you give bath to the child with very hot water, the child's skin, as I just said, is so sensitive that the pores open up so easily and they'll perspire more. So if you give them bath with very hot water or warm water, then there are chances the skin becomes more sensitive and more dry, and it can cause other skin issues like eczema and dermatitis. So give bath to the baby with lukewarm water. Now, how do you check that? Is usually this is the area is very sensitive, your elbow area. Immerse it in water. First check for yourself how the temperature is, and then let the baby get in. Now, when you carry the baby and put the baby in, it's practical enough to give the baby a head bath first. So while you're holding the baby's, you're supporting the baby's neck from behind, you see to it that you give head bath first, then wipe with cotton plugs the eyes from inside out again, and then wipe the face again with the cotton plug in one go. Once you do that, then you go over the body and then the feet and other parts. So that becomes easier to handle the baby. Also, it's a known fact, more you touch the baby can actually feel the senses gets more enhanced. They feel that security which they are feeling in the mother's womb. So touching, giving massage, it in fact enhances their sensitivity and the human enhancement or the human attachment. Also, while giving bath, it's best to just keep on conversing or singing so they feel that positive environment around them. So keep on talking. It also works like a soother for the baby. So once you give the baby proper bath, then the other important step that you need to be careful about is you use a soft towel or to wrap the baby, and see to it that you completely dry the baby. If the baby's skin remains moist, then there are chances that that could cause bacterial infection or fungal infection that could itself lead to some kind of skin issues. And at such a tender age and fragile age, you don't want babies to go into complications. Of course, in case if they do, we as doctors are here to treat. I have treated n number of patients with the complaints of eczema, dermatitis, cradle cap, lots of things that usually the kids come up with. But to prevent the child getting into disease, if you just follow these basic steps, you can go a long way further. So 1, give them bath with lukewarm water, which I just mentioned. Number 2, after giving bath, you see to it the baby is completely dry, and then make the baby wear clothes, but such clothes which are practical enough rather than just for show. Now, in case if your baby's skin is too sensitive, you can also use a moisturizing cream. And there is one thing that I would want you all to avoid is using talcum powder, because powder actually works like, it is powdery elements. It works similar to dust and has been causing a lot of allergies in kids. I've had so many children nowadays coming with allergic rhinitis and bronchial asthma. So to prevent that, let's just completely avoid using talcum powder. If you're putting the baby on the diaper, see to it that the private part is completely dried. You apply some thick cream and in the diaper area. In case if the baby doesn't have diaper rash, then maybe you can apply some Vaseline petroleum jelly, like a thicker base. And if the child has diaper rash, then just on the diaper rash area you can apply ointment which has zinc oxide base, like one of the example is Decetine. So just apply in that area and then you see to it that you make the baby wear diaper. Okay, when you're making the baby wear diaper, there are a few things that you need to check so that you prevent the baby getting diaper rash or any other kind of skin complaints. Now, what do you check for diaper? One, see to it that it fits the baby well. It's not too loose, it's not too tight. So get the right size for the baby. Number two, you see to it that you check the diaper after a few hours. In case the baby has soiled, you don't want the baby to be in diaper while they have passed motions or stool, because that itself can cause the infection and the diaper rash. The other thing that you need to do while making the baby wear diaper is, before making them wear diaper, see to it that every fold in their thigh, around the buttock area, is well moisturized with petroleum jelly. You can also use like a thicker coconut oil and then make them wear the diaper. Okay, so these are few of the things that I wanted to share about bathing and about the diaper. Now, for the skin care, one needs to be very, very careful about the product they are using. And I would suggest all the parents to first do a patch test on their skin and then on the baby's skin, and then use the product. This could be for all kind of products, from the moisturizing cream, from the soap bar, to the shampoo, to the detergent, whatever you all are using. See to it that first you do a patch test on yourself and then on the baby, and only then start using it, because some children's skin are so sensitive that it completely reacts to whatever you are doing. Now, the area where you can do the patch test is usually this part where your skin is very sensitive, and just apply that product for some time, let it be for some time, and see if it's reacting to your skin or baby's skin. Also be very careful about the kind of product that you are choosing, and there are certain things that you need to look for. Okay, now what are the things that you look for? One, choose a product which is natural, which is nourishing and has edible ingredients. Okay, now what does that mean? Natural, of course we know what's natural, what's nourishing, but edible is something which is again organic product which is fragrance free, which is chemical free, and which doesn't have paraben. Definitely check for the ingredients of the product. There are some products where they will name that maybe it is fragrance free or hypoallergic, but what about the ingredients? We sometimes skip upon the ingredients, and we do not want to take a chance with the product that you're using for your baby. So there are these about 6-7 ingredients that shouldn't be in your product, and you can check before using it. Okay, first one is talc. Talc is literally the powder, the talcum powder. The talcum powder, talc name comes from that. Now, why that should not be used? It is a powdery element, and it seems that it can cause lung carcinogen, also extra dryness to your skin. So instead of preventing the skin from eczema, it creates more problems. So rather see to it you don't use talc and use moisturizing cream. The other thing that you need to check in your product is it should not have any kind of fragrance. So usually synthetic chemicals are added to get that lovely fragrance, but that is what we don't want at all. We want natural products in it. The third thing that you need to check is propylene glycol. Now, what is propylene glycol? It opens the pores of the baby so much so that the product that you are using is absorbed easily by the skin, and that is exactly we don't want. So in case if your product has propylene glycol, it could also be carcinogen. Completely avoid it. Okay. Also check in case if it has mineral oil in the product. Now, usually mineral oil is added again to give a fragrance, and it's a cheap byproduct of petroleum. You can imagine that that mineral oil is actually working like a wax on your body, on your baby's body, and it wraps the skin like a plastic wrap. So it prevents from releasing any kind of toxins. And our body or skin is made in such a way that there are certain toxins that has to be released through perspiration, through urine and stool. So if the perspiration itself is blocked, imagine what it can create. So avoid products having mineral oil. So, and see to it that then what kind of oil you can use in a product. See to it that you use natural nourishing oils like that of olive oil, coconut oil, almond oil. These three oils are the safest and the best and the most nourishing. Okay. Avoid paraben in a product. What does paraben do? It has neurotoxins which is linked to reproductivity. So it causes toxicity and hormone disruption and skin irritation. I know a lot of parents have been quite aware about paraben free because it's been advertised very well. But the other ingredients that just mentioned is the one which is not known to parents. So be very careful. One more product that you need to be careful is about triclosan. Now triclosan is, on the product they write in bold it has antibacterial property. And we as parents think that, oh wow, we are actually preventing our child from any bacterial infection. Well, that's not true. Actually, what you're doing is, the antibacterial property, it doesn't allow the immunity of the baby to fight or protect itself. Immunity is a big subject. We've been talking about this, especially in this pandemic, and all of us see to it that we just build immunity, which is one of the things I have been doing. I've come up with immunity kits for babies, adults, and that's a different subject we can talk about. But see to it that you don't use a product which itself lowers the immunity of the child. And triclosan is one of the product which in fact prevents. They say, okay, we won't cause bacterial infection, but sometimes the wear and tear is good of the body, because that's how you kind of prevent yourself. Okay, so these were a few of my suggestions for the baby care skincare. I think I will start taking questions now on. Okay, lovely. Hi Swati, hi Anwar, hi Pranjal. Okay, Karan says, what should I put on my baby skin after a bath? Okay, so Karan, I was just explaining how you take care of the baby, but so after giving bath to the baby, most important step is just dry the baby well. Use a fresh soft towel and dry the baby well. After that, you can use a moisturizing cream, which is fragrance free, no chemicals. I was just telling about the products that you need to check that it doesn't have hypoallergic, and that way the baby's skin becomes much more subtler and smoother. Okay, we Indians have a very good tradition of giving massage to the baby and then giving a bath. Actually, that's the best way, because you give massage, see to it that you give it the natural oil, maybe like an almond, coconut or olive oil, and that itself helps to retain the sensitivity, the moisture of the skin. And after giving massage, we give baby a bath. So the extra moisturizer through the oil which has come on your body is taken off, and what remains is just the essential moisturizer remaining, or essential for the baby. So massage the baby first, then give a bath, and after that you can use moisturizing cream. I would suggest Bioderma Etoderm is one of the fab products that I've ever come across. Why? Because it has a lot of natural ingredients. It has glycerine, it has shea butter, and it's the only product which helps to prevent from the skin barrier technique that our skin is made from. So it naturally brings that pH balance in the body. So Bioderma's moisturizing cream itself is good. You can give bath with the Bioderma pan soap bar too. So this can help you after you give birth to the baby. Should one moisturize the baby's skin? Pallavi asked that. Yes, Pallavi, you should. I just mentioned that. Only in the diaper area, see to it that you use a thicker cream, like petroleum Vaseline jelly. In case if your baby has a rash, then you can use an ointment again which is thick and it has zinc oxide in it. Okay. Akansha says hello. Hi Akansha. Aishwarya, can babies use Vaseline on dry skin? Absolutely, but Vaseline, if you're asking about Vaseline lotion, I would say it's better to use Bioderma Etoderm moisturizer, because that is hypoallergic. Vaseline is a little thicker for the baby, so but you can use the Vaseline petroleum jelly on the diaper area. That really works. Okay. Pranjal, thanks for this important information. Pranjal, welcome. Diksha, which soap is best for baby dry skin? Diksha, I think, while I was explaining, you need to search for a product which is chemical free, doesn't have any kind of fragrance, which has no, which is naturally made. And I think Bioderma's Etoderm Pan soap bar is one of the best that you can use for dry and sensitive skin. In fact, it's done wonders for, I've seen in older patients too. So if a young girl around 20-25 would come to me with a complaint of very sensitive skin, I would ask them to use the Bioderm product. Okay, so you can try using that. Aishwarya again, how to clean baby's ears? Okay, Aishwarya, yeah, that's a big question that, because you cannot use a earbud. It can sometimes cause injury to the middle ear. So instead, what I recommend is there is this ear drop called Waxol. So you just put few drops in the ears and then keep it close. After some time, the wax automatically comes out, and then you can clean the outer ear with the wax bud. Do this, but only in children above the age of 1 year. Don't do for very, very small kids. It's not required. Okay. Okay, Kumud is asking, should I give my baby bubble bath? So Kumud, though bubble bath sounds quite a lot of fun, and in fact we've seen a lot of advertising, and we as adults also would want to do bubble bath, but all said and done, I would not recommend for children. The reason is, the bubble bath, whatever the ingredients they use, it's quite hard for the sensitive skin that the babies have. So to avoid that, one must not use bubble bath. Also, it's seen in the girls, while they're taking bubble bath, the vaginal area is very sensitive, and the bubble bath itself, the chemicals which are there in that can cause few sensitivity. So I would ask you to avoid it. Okay. Next question, Rohan. Which soap is best for baby dry skin? Rohan, I just mentioned. Use a soap which has glycerine, which has moisturizing agent, which can take care of the skin barrier technique, or which can take care of the pH balance of the baby's skin. And I think I've come across one of the best product which is made by Bioderma. So I would recommend you to do that, take that and utilize it. Also let us know your reviews. How do you feel after using it? We'll be grateful. Okay. Next is Pranjal, is Etoderm safe for my baby? Yes, absolutely safe. Etoderm is, there are these 6-7 parameters which I just mentioned earlier, and Etoderm doesn't have any of those parameters that you need to avoid. Therefore, it's absolutely safe. It's natural. In fact, it nourishes the skin, makes it soft, subtler. More so, it's recommended for kids having dry skin or kids having eczema or dermatitis issues. Also, it works very well for people having very sensitive skin. Okay, so you can try using it, Pranjal. Next is Manisha. Hi, Manisha. She's asking, my son is 3 years old. The skin color around the butt is turned black. Using diapers for 3 years. How do I get rid of it? Okay, Manisha, in case if you're using diaper for a continuous time, this could change the color of the skin around the buttock area. See, the skin of this children, especially younger kids, is so sensitive and fragile that in case if slightest friction, if there is too much of rubbing, then it can cause irritation, diaper rash, and once that diaper rash is healing, that can change the color of the skin. Maybe that much is what is happening. So I would recommend slowly about, it's also time, he's 3 years old, that you need to potty train your child. So let the air come in. Try and keep your child away from diapers only the time when he's sleeping, so that you are not worried that he will soil the bed sheet. But it's high time that you potty train your child. Also the areas where it's the skin has turned black, slowly it will start healing, and once it comes in touch with the air, so the body's the skin color will also slowly change. Okay, so try doing that. Nishita says hi Pallavi. Nishita, is it okay to use Vaseline on baby skin? Nishita, I just answered that. It's absolutely fine to use Vaseline petroleum jelly, especially on the diaper area, but per se the whole skin, you need to check for the ingredients and see to it that it's not it's chemical free, paraben free, no fragrance, hypoallergic. Okay, and try and do a patch test on yourself first and the baby, and only then use the product. So whatever product you're using for your babies, including even the detergents, see to it that they are absolutely mild. Okay, and then you try and use this. Okay, next is Anju, what should I put on my baby skin after a bath? Anju, I just mentioned a few questions back. If you just roll it in front, I've mentioned what you can do. Okay. Manisha, all good brands for cream and soaps for kids with eczema. Also any good brand. Okay. Manisha, we need to understand what is eczema. Now, eczema is the body's reaction where what is the complaint the baby comes with is extreme dry skin. There could be redness. There could be few patches, and this is seen in very young kids. It's seen in the outer layer of the skin, so uncovered parts, especially the face. But as the child is growing, so it is seen between 0 to 6 years of age, you will see eczema patches coming on the joints. Now this eczema is also a deeper issue. Being a homeopath, we know that there is a direct connection of mind and body. And when a child comes to me with eczema issues or seborrheic dermatitis, I definitely take into account, one, the allergy history in the family. That means if in the family, if there is a history of tuberculosis, of allergies of any kind, allergic rhinitis or urticaria, that is a skin complaint, usually there is a direct connection. So one is genetically, I would check. Number two, I would check is for pregnancy history of the mother. It is known fact that in case if the mother is gone through any kind of stress, strain, she passes on this kind of chemical imbalances which she feels, or anxiety or whatever she feels during pregnancy, to the baby. And the baby could have these chronic issues. Now, the chronic issues, if not related to the pregnancy history or any kind of genetic way, then the third thing you need to notice is, what are you doing for taking care of the baby's skin? So you might be wrong in that. For eczema, the treatment, holistic approach, if you want to have, use the right kind of product. See to it that you can take homeopathy for the same. Even whatever topical ointment you are using, see to it that they do not have steroids. So because these can cause suppression in the baby's body, and it's seen that if you suppress the eczema, the dermatitis, it can cause asthma. Then it's very difficult for us to treat. Though I've treated them also, but it's really difficult. So just to prevent it, take care of your baby's skin. See to it you moisturize well, you use the right product, you don't give them over, you don't overbathe them, and you take care of all things required. I think there is some issue with charging as well. Okay, I'll take a few more questions. Just hold on. I'll just try taking a few questions more. Okay, sorry about that. There is some Wi-Fi issue in my place. Of course, this cyclone had made it worse, but today I don't know what's up. Am I audible, guys? Okay, I'll try and take it closer. Okay, let me take next question. Okay. Pallavi asked, my nephew is 2 years old. He has dry skin. Any suggestion? Pallavi, I would suggest you use for your nephew such a brand which nourishes the skin and makes it softer and subtler. Bioderma, Etoderm has lovely products right from the soap bar to the moisturizer to the balms. You can try all the products and it will surely help and prevent the dry skin of the baby. Also see to it if you are giving too much bath twice or thrice in a day. Avoid it completely. That itself will not help the skin to be nourished and remain like having natural nourishment. In fact, it will make more dry. So avoid using that too. Okay, Manisha. Okay, you're clear to me. Thank you, Manisha. That's such a relief when you say that. Okay, Aishwarya asked, can Etoderm be used by adults as well? Absolutely, Aishwarya. I would recommend that you use it for the adults as well. Okay, especially adults having sensitive skin, very, very sensitive skin, the adults can use it. Okay. Okay, Manisha is asking again, should soap be used to clean a toddler's face as well? So Manisha, while cleaning the toddler's face, one has to be very careful because of course it can go, the children, especially the toddlers, are quite playful and you want to avoid it from going into eye or them swallowing a little bit. But if the soap is used, it has to be used in circular motion, you know, around the cheeks, around the lips and on the forehead, and then quickly splash a lot of cold water. So avoid using warm water on the face because the face skin is more sensitive. Okay, we need to be careful about that. But if you ask me, can the soap be used? So yes, it can be. An adult can take a little bit of soap in their hand and then apply over their face and splash quite a lot. Okay. Mohit asked me, how often should you bathe a newborn baby? Mohit, I've answered this earlier, but I shall again repeat it. For a newborn, till the umbilical cord falls off, which is usually up to 2 weeks, you just give a sponge bath to the baby. After that, you give about 3 to 4 times a week only, proper tub bath. But other days, you give sponge bath to the baby. Okay, if you overbathe the baby, then it can cause a lot of dryness, and which is what we don't want, because we want to prevent it from dry skin and eczema or any other skin problems. And therefore, I keep on insisting about using a good product which can make and nourish the child's skin further. Okay. Manisha asked me, you can take on basin and milk as home care for toddlers. Manisha, it's known that basin and milk, especially basin, causes allergies to children. That's something I would want you all to completely avoid it. So there are certain things that, you know, as a norm, we Indians used to follow as a tradition, using kajal in the eyes or putting some oil in the ears, all the openings, doing this basin, you know, doing the basin atta all over, like a lake all over the body, and then giving the bath to the baby. That is known to cause, in fact, like a thicker layer it forms, and it in fact avoids the toxins getting out of the body and absorbs the body. The skin is so sensitive, the baby, that it starts absorbing the basin, which is what we don't want and causes allergies and skin rashes on the baby. So completely avoid it. Okay. Manisha is asking, hey, thanks for the eczema help here. Yes, I had stress during pregnancy, was carrying twins. You forgot to suggest me the brand of the cream and the soap. Yes, so sure. So, you know, for eczema, you can use the brand Bioderma, Etoderm, Pan, soap bar and also the moisturizing cream. You can happily use it for your child because it doesn't cause any problems. In fact, it helps to soothe the skin. And use this brand and let us know how do you feel with it. That is what I would suggest, right? Manisha, can you hear me? Can you hear me, Manisha? Manisha, can you hear me? Yes, so Manisha, I was suggesting that yes, I understand you had stress during pregnancy, especially because you were carrying twins, and it's very normal to feel anxious at that time. But at the same time, I would want to suggest the brand is you can happily use Etoderm, the Bioderm Etoderm Pan, which is a very safe product for the children. It helps to maintain the pH balance and the nourishment. It retains the nourishment of the skin and the natural, the natural oiling elements of the skin. So you can continue that. Yeah, so that's the brand I would recommend. Any other questions that you have, guys, I would be more than happy to answer. Thank you, Manisha. Thanks for those kind and sweet words. Okay, I think there are enough questions. Any other questions till I sign off for now? And I can come up later with more queries. My expertise lies on a larger area, so I can answer any of your questions, queries, even pregnancy care, baby care, any sleep problem, skin problem. I'll be more than happy to help you. Yes. Okay, so I think I'll be signing off for now. Just one last suggestion from my end to you all is baby care and child care is just like that. Is as if you're sowing the seeds and you as a parent wait there for the seed to turn into a plant and then into a tree which can bloom. So parenting is all about that, and you need to be a smart parent while dealing with your child. And one can be a smart parent only by using right products, getting the right information, and that's what we all are here for. So thank you so much, Swati, Pranjal, for having me over, and would love to come again. Bye for now. Thank you.